Hello, this is MedSurg Nursing, Brain Disorders. This is part 4, Headaches and Cranial Nerve Disorders. First, we're looking at migraines as part of headaches. Migraines are typically constriction and subsequent dilation of cerebral arteries. Usually occurs irregularly and may begin with an aura such as visual disturbances or spots before the eyes. Many patients with migraines do not have an aura preceding the attack. The pain begins on one side of the head and is described as throbbing in its character, often accompanied by nausea and vomiting. Symptoms usually last 4 to 72 hours. Light or sound cause irritation and sensitivity, and certain types of light set off the headache as well. Just think about like those strobe kind of lights can set that off. Cluster headaches. Once again, these have more of a severe pain, abrupt in onset, and usually last 30 to 90 minutes. They may start during sleep and recur several times a day and usually last 2 to 3 months. This could be very much debilitating for this person. They don't know the clearly unknown the etiology, but it was thought that is vasodilation. Signs and symptoms, once again, is unilateral, orbital, supraorbital, temporal. So it's kind of like the side of the face. Person may have redness of the eyes, tearing, nasal congestion, dripping of the nose, facial swelling, pupil constriction. So this is where you may have unequal pupils as well, as it affects one side of the face. The person becomes restless and often paces the floor and is sensitive to touch. Once again, they're in lots of pain. Diagnosis usually is through history. They may do a CT and MRI or magnetic resonance angiogram just to rule out that there is not a tumor or aneurysm or something else causing the headache. So treatment usually is a combination of analgesics and 100% oxygen by face mask. Once again, this is going to cause vasoconstriction to a point, that 100% oxygen. Emitrix and other triptans are usually used. Opiates are not used because that can cause rebound headaches. Tension headaches, once again, are common but not as severe as migraines or cluster headaches. This is more, think of these more of muscle tension kind of things. So you have neck stiffness, limitation of range of motion of the neck. Treatment usually is analgesics, muscle relaxants, maybe tension reducing medications, relaxation techniques, massage, yoga, and actually biofeedback can be very effective in preventing the headache for several people. The next one is not a headache. This is more trigeminal neuralgia or tic douloureux. Here, we don't know the cause of it, but it's a result of increasing afferent firing of the nerve or failure of the inhibitory mechanisms. So pressures on the nerve root by a tumor or lesion of the blood vessel can cause this too. So once again, this could be because, we're going to be firing off and there is nothing in there telling the nerve to stop. It typically involves the fifth cranial nerve that has actually 3 branches to it. It has the ophthalmic, mandibular, and maxillary. So the ophthalmic, which actually does the eyes, it's not truly involved. So it's going to be more the mandibular and the maxilla area that's going to be very painful to touch, or sharp shooting kind of pain, intense, lasting 1 to 2 minutes. Once again, nerve pain is impossible to take care of. Medical management, once again, there to relieve spasmodic pain, may give them anticonvulsants like Tegretol or phenytoin, muscle relaxants like baclofen, or other anticonvulsants as well, could be effective on some patients. Bell's palsy, Once again, this one is more of a weakness or paralysis of muscle supplied by the facial nerve, typically affected the right side of the face. So etiology is usually caused from edema and ischemia that compresses the facial nerve. This could be because of herpes simplex or herpes zoster viruses like shingles will cause this. Stress, exposure to cold can also be a factor. Signs and symptoms, we will have numbness and partial or total paralysis of facial muscles, suddenly over a few days, taste disturbances, and eye or eyelid can be affected where they can't blink. So what they'll probably end up doing is closing the eye, putting a patch on that, putting artificial ear tears in that because they've lost blink reflex, and we don't want that cornea drying out and stuff. We may give corticosteroids because that's an anti-inflammatory, and acyclovir if it is from the herpes virus as well. Diagnoses, we're going to be by history, and we're finding out if it is actually maybe because of Lyme disease too, which is from ticks. Also, we're going to ask the patient to raise the eyebrows. If the eyebrow is affected, side will not move. Once again, because it's affecting that nerve, so they can't use that one side, so it almost looks like they're having a stroke. When asked to smile, the face becomes distorted, but once again, because that nerve there is not moving appropriate. Okay, that finishes that part. Thank you.